Hello guys, it's Ala here. Today we're gonna talk about medical device at the hospital. We have anesthesia machine. What is anesthesia machine? Anesthesia machine is the apparatus used to deliver general anesthesia to patients as they undergo medical procedure. Next is anesthesia machine function. First, it provides oxygen. Second, enable patient ventilation. Third, minimizes anesthesia-related risks to patients and staff. Last, accurately makes anesthetic gases and vapors. Anesthesia machine placement. Anesthesia machines are usually placed at operation room in hospital. Next is technical features of the anesthesia machine. Then, ppm of anesthesia machine. Lastly, problems and troubleshoot. Next, we have ventilator machine. What is ventilator machine? Ventilator machine provides mechanical ventilation by moving breathable air into and out of the lungs. Ventilator machine function. Ventilators help a patient breathe by assisting the lung to inhale and exhale air. Ventilator machine placement. Ventilators are mainly used in hospital and in transport systems such as ambulance and medevac air transport. Technical features of ventilator machine.
A mechanical ventilator is a very complex device, which is used to ventilate patients suffering from chronic lung diseases or after a complex operation, to keep them alive, strong, and healthy. A patient with severe lung disease needs a ventilator for life support. All ventilators should be tested after each use to verify its performance before the unit is used for another patient. Ideally, a verification based on the manufacturer's recommendations will be performed each test. It takes about 2 hours and documentation is required at each step. To test ventilators from different manufacturers, someone has to read the instruction manual for every ventilator. This could take weeks and is just not a good solution. An all-in-one testing device with all the necessary tools would be great. Fortunately, that option is available. The Citrix H5 gas flow analyzer from IMT Medical is able to test any type of ventilator. It measures pressure, flow, volume, temperature, and oxygen. The Citrix H5 can generate customized PDF test reports automatically. Additionally, integrated apps guide the user through the procedure so you can test a ventilator in less than 5 minutes. Test report included. This sounds exciting, right? Now, let's get started. Download the app from the Citrix Cloud. The app guides you through the following 3 simple steps. First, connecting the Citrix H5 to the ventilator. Second, performing verification test. The Citrix H5 gives you instant test results automatically. Isn't that great? Third, generating a test report. After the test, enter the user information.
Problems and troubleshoot of ventilator machine.
Okay, my name is Nazati Izzah binti Zawri and this is my metric number. Today I would like to talk about the infusion pump and the pulse oximeter. Infusion pumps. Infusion pumps may be capable of delivering fluid in large or small amounts that may be used to deliver nutrient or medication such as insulin, hormone, antibiotic, chemotherapy, drug, and pain relief. Some infusion pumps are designed mainly for stationary use at the patient bedside. An infusion pump is a medical device that delivers fluid such as a nutrient and medication into the patient body in a controlled amount. Infusion pumps are used in a clinical setting such as a hospital and nursing home. A technical feature of infusion pumps is audible and visual alarm for occultation, empty, low battery and infusion, syringe dose and bronchotic. Number 2 is a HD LCD display. It have a high capacity words, a friendly user interface, a dynamically display working status. 3 is a compatible with a 10 ml, 20 ml, 30 ml and 50 ml syringe. Other than that, preset the solution volume greatly reduce the workload of the nurse. These infusion pumps have a 3 level of occlusion, which is a high, middle and low. And it also have a purge and bolus function. Okay, for the prevention maintenance of infusion pumps, first we have a qualitative test testing to verify the physical integrity cleanliness. Mount for the verified physical of integrity of mount, caster bracket if mount on IV pole verify physical integrity, line cord verify proper insulation and integrity, circuit breaker fuse to verify the external circuit, cable inspect a drop sensor and external air in a line detector, connector examining all cable connector, quantitative test which is a grounding, chasing leakage, flow accuracy, and last is a maximum pressure and occlusion alarm. Okay, for the problem and troubleshooting of infusion pumps, first is improper equipment cleaning. Stigma spectrum need to be accurately followed on a regular basis. To solve this problem, we need to do the regulation for pump cleaning and all other instrument cleaning. Okay, second is staff member ignore the alarm of infusion pump. It will cause the problem with those error, improper pump cleaning and missed important alert. Number third is those error. Staff member must be trained on going basic and a proper procedure at all time. Fourth is air in tubing, spike new IV bag and reprime the tube. Low battery power is one of the problem of infusion pumps. So we need to plug in this device. And last is downstream occlusion alarm to allow pump to establish a new baseline pressure. Okay, kids, we are proceed to function of pulse oximeter. The pulse oximeter are used to check how the condition of heart is pumping oxygen through the body. Pulse oximeter also be used to monitor the health of patients who get asthma, anemia, lung cancer, and also heart attack. Small beam of light through the blood in the finger measure the amount of oxygen. It does this by measuring change of light absorption in the oxygenated and deoxygenated blood. This is a painless process. Pulse oximeter will thus be able to tell your oxygen saturation level along your heart rate. Okay. So the technical feature of pulse oximeter is pulse oximeter measured two things, which is a blood oxygen saturation (SpO2) and the heart rate. Okay. To estimate of the oxygen amount that is carried by the red blood cell. The normal range of pulse oximeter is 95 to 100%. For the heart rate, normal condition range from 70 to 100 ppm. Okay, for the technical feature of pulse oximeter is battery life fully charged in 6 hours, have a LED display flash to alert to check its sensor placement, got a rechargeable pulse oximeter also operate on an AC power via the AC battery charger. Okay, so this for plant prevention maintenance of pulse oximeter. First is physical condition. We need to check this pulse oximeter to make sure the device is clean and in good condition before use. It also needs to electrical safety. We need to make sure check the ground wire and chasing linkage. That is the battery replacement. We should do battery should be replacement every 24 months. And lastly, for the performing testing, we need to check the AC power indicator is lit when the power cord is dark, and also we need to check the boot of heart rate and the SpO2 before use to get the accuracy result. Okay, for the problem and troubleshooting, first we have the pulse oximeter does not respond when you turn it on. Pause and hold power button and wait for 3 to 5 seconds until the screen turns on. Okay, if the oximeter display a reading with a low fusion, we need to check the probe and insert the correct way. The oximeter doesn't fit in a charging carrier or the charger, we need to pull back yellow protective case and insert the oximeter into the charging powder. If the probe is not producing a steady reading, we must ensure that the two sensors are directly opposite each other when attached to the patient.
Hi, I'm Emiliano Shahira Mutahiriza from the Udema A. I would like to introduce you about two medical equipment in hospital. And this is defibrillator. Defibrillator are devices that restore a normal heartbeat by sending an electrical pulse or shock to the heart. Technical feature: provide quick, effective AED use, easily convert to manual mode, compact and lightweight, for easy carrying, easy to maintain and service. EPM. This is a fuel maintenance and testing guideline. Performance inspection procedure, PIP, testing and calibrate procedure, TCP, exterior and interior physical inspection, exterior and interior cleaning, fine battery replacement. This is SpO2 cleaning and internal cleaning procedure. You just need to follow this guideline. Troubleshooting of this device, defibrillator. Patient monitor. The aim of patient monitoring is to give warning of early or dangerous deterioration and to achieve this by obtaining an optimal compromise involving many design factors, clinical, engineering and economic. Technical feature. This equipment has many language, and then a new display, waveform, operation mode and other. Fast HRV analysis function, NIDP measurement mode. This equipment also have 71 alarm. Also have drug calculation, print trend, table data, and anti-high frequency surgical unit defibrillation proof. PPM you need to check before use every 6 months and every 12 months. Cleaning this equipment, and last is troubleshooting.